Hello, my name is Louise, and I'm a mother, grandmother, sister, and friend. I lived in Medicine Hat, Alberta for most of my adult years. Now I live in Calgary, and I am 69 years old. I have two autoimmune diseases, and on the heart side, I have ischemic cardiomyopathy, bradycardia, and heart failure with reduced ejection fraction. And I have an implanted ICD, pacemaker, and defibrillator. My medical journey began at age 27 when I was treated for a blood clot in my lung. 5 years later, I had lumps removed twice from my lymph glands. At 34, I was diagnosed with two autoimmune diseases, lupus and Sjogren's. With lupus, my body's immune system attacks my own tissues and organs. I managed for 14 years, but after struggling with swollen joints, rashes, and mobility issues for a year, I went on long-term disability at age 49. My lupus became stable with treatment, but serious issues kept surfacing from both the diseases and the medications. By age 55, I was also taking 4 heart medications. At age 62, I had a massive STEMI attack, also called a widowmaker. In my small city, there was no cardiac unit, so they gave me a clotbuster IV in emergency and flew me 300 kilometers to Calgary, where a stent was implanted, and I spent 11 days in recovery. A year later, I fell unconscious and had another STEMI heart attack. Again, I was given a clotbuster IV and again flown to Calgary for another lengthy stay. Because of the trauma and injuries from the fall, cardiac intervention was delayed while I was assessed for brain damage, broken bones, and bleeding. I was a survivor once again, but this time I left the hospital with an ICD implanted in my chest. There was no cardiac information or support system in Medicine Hat, and there was nobody in my world to talk about it. I participated in cardiac rehab twice, which got me safely moving again. I became an avid walker, and I got a smartwatch and started tracking my steps every day. Over time, I increased it to 10,000 steps a day, which has helped both my physical and mental health. My doctors have said that my walking is what is keeping me alive. In 2019, I moved to Calgary to be closer to my family and the care that I needed. And then COVID hit. My new cardiologist shattered my happily ever after dream in 2020 when he told me I have heart failure. I was in shock. Looking back, I knew all about my autoimmune conditions, but absolutely nothing about my heart issues. So I went into learning mode, reading cardiac reports and my own medical history. I got copies of my EKGs, echocardiograms, and ICD reports. Then over the past year, I started to connect with other heart patients in Facebook groups. Listening to other people's stories was comforting to know that I was not alone, and it normalized my new heart world. Now I listen to my doctors and go prepared with questions, and I never miss taking my medications. I stay organized because I have over 80 medical appointments every year, a long list of medications to organize, and reports and lab results to review. My lupus is under control. My heart is currently stable, but I know challenge lay ahead. I encourage you to learn your medical history and understand your current issues. Be aware of what could happen, but focus on today. Heart events are usually unexpected, so accept that your mental health will be fragile. Stay busy mentally, keep an active to do bucket lists to keep you focused on living. My time is precious. There's a lot of things I want to do, and I want to make more memories with my family and friends. To do that, I have to put myself first and look after my own heart and mind. I do that with exercise, medications, stress management. Every day I wake up, I am truly grateful. My life was upended by autoimmune diseases and then uprooted again when my heart journey took me down another path in life. I am now committed to raising awareness about women's heart health through advocacy, friendship, and participating in patient activities and research. I hope you can start every day with a smile and know that there is still time to accomplish more dreams. Thank you for listening to my story.
Hello, everyone. My name is Al-Khalaf, a cardiovascular research scientist at the University of Ottawa Heart Institute. In support of the WearRedCanada campaign and the Canadian Women's Heart Health Alliance, here with us today is Dr. Paula Harvey. Dr. Harvey is the physician-in-chief at the Women's College Hospital, a scientist at the Women's College Research Institute, and an associate professor within the Department of Medicine at the University of Toronto. An expert in systematic inflammatory and autoimmune disorders, today we have the pleasure of briefly talking to her about the female-specific information and challenges faced in dealing with these disorders and their effects on cardiovascular disease. Thank you for being with us today, Dr. Harvey.
My pleasure.
To start, can you provide us with an overview of what systematic inflammatory and autoimmune disorders are and how they relate to cardiovascular disease, specifically in women?
Thank you, Mo. So in autoimmune and systemic inflammatory disorders, the body's defense system recognizes certain tissues or cells in the patient's body as foreign. And because they recognize these cells as foreign, the body's defense system or immune system then attacks these cells and these tissues. And this attack can cause inflammation, scarring, or even death of those cells and damage to those tissues and organs. Now, examples of these systemic inflammatory and autoimmune conditions include lupus, or the full name is systemic lupus erythematosus, rheumatoid arthritis, multiple sclerosis, and some of the inflammatory bowel diseases. There's about 80 or 90 different types of autoimmune or systemic inflammatory disorders. Now, for some reason, we don't really understand why it is, these disorders disproportionately affect women. So in particular, if you're looking at things like lupus or rheumatoid arthritis, you'll see that more women are impacted by these diseases than men. Now, because you can get inflammation of organs and tissues, this feeds into an increase in risk of cardiovascular disease, which I'll expand on shortly. And we know that this therefore means that the women and the men, but we're disproportionately affecting women, are at increased risk of cardiovascular disease if they have this other disorder.
Thank you. Next, I'll ask, what are some of the known causes or cardiovascular risk factors associated with these disorders?
So it's probably a number of different things. Firstly, what we call traditional risk factors like high blood pressure, high cholesterol, tendency to diabetes, sedentary lifestyle, they appear to be more prevalent in many of these conditions. And that may be due to a number of factors. It may be because people are more sedentary because they're unwell and they're unable to exercise. They have more tendency, therefore, not to just be sedentary, but to carry excessive weight. It may also be that the medications that they're on may make them more susceptible to high blood pressure and diabetes, high cholesterol. For example, corticosteroids are used frequently in a lot of these disorders. They're very effective in dampening down the inflammation, but their side effects include worsening of traditional cardiovascular risk factors. So that's one factor. The other factor is that you're getting generalized systemic inflammation. And what we know now is that the buildup of plaque in our arteries, in the heart and in the brain, that plaque is called atherosclerosis. And we know that that actually is an inflammatory disorder. So when your blood vessels are inflamed, you build up plaque, and a lot of unstable plaque that is very at higher risk of causing complications like heart attack and stroke. And so you have a systemic inflammatory disorder like rheumatoid or lupus that's causing inflammation of all sorts of tissues, including the blood vessels, which then can lead to plaque buildup, atherosclerosis, and an increase in risk of things like heart attacks and strokes. Now, this is particularly important if you're talking about women. So women are disproportionately affected by these disorders. And we know, for example, in a condition like lupus, that a premenopausal young woman with lupus is up to about 50 times the risk of having a heart attack compared to a premenopausal woman who doesn't have lupus. Just to give you an example of what that impact might be.
Thank you so much. What information can you share with regards to steps that should be taken to face the specific challenges of cardiovascular disease with respect to systematic inflammatory and autoimmune disorders?
Okay, so the first thing is awareness. We need to be aware, and whether that's the clinicians that are looking after patients with these disorders, and that could be the family doctor, it could be a rheumatologist or an immunologist, but cardiologists need to be aware. Everybody needs to be aware of the increase in risk, and that the increase in risk does depend on what sort of inflammatory rheumatic disorder you have, but pretty much all of them are associated with an increase in risk. So that's the clinicians need to be aware, and the public and the patients need to be aware. So if you're suffering from one of these conditions, be informed and make sure that you understand that it's not just the direct effects of this condition, say on your joints, that you need to be aware of, but it's also your overall cardiovascular health. So awareness is critical. And then we need to be looking at things like making people have as healthy a lifestyle as possible. So making sure that even if you're limited by, for example, joint inflammation, you're trying to do as much physical activity as you can within those limitations, that you're eating a healthy diet, you're getting good sleep, you know, that we're paying attention to these healthy lifestyles that promote cardiovascular health. You also need to make sure that you're optimizing your cardiovascular risk factors, not just through lifestyle intervention, but you may need to have medications to optimize your blood pressure, your cholesterol, make sure you're not developing diabetes. So I really think that it's a mixture of that awareness, the healthy lifestyle, advocacy, and making sure that you are doing your best and that your physicians that are looking after you are doing the best to keep you as heart healthy as possible.
Absolutely. Much appreciated, Dr. Harvey. Finally, today, could you share some words of wisdom or advice to the audience to raise awareness around women's heart health and well-being?
You know, that advice is a little similar to what I've just given regarding patients with the systemic disorders. Whether or not you have a systemic autoimmune inflammatory disorder or not, I think it's really important that we do address these factors of awareness, that we understand that women across the lifespan are at increased risk of cardiovascular disease at a variety of different times in their life, that we need to be addressing cardiovascular risk factors, that their clinicians need to be aware, and that we are living healthy lifestyles that promote cardiovascular health. And really, if you're promoting cardiovascular health, you're promoting overall health for yourself and for your families if you're a caregiver. So I think there's a lot that needs to be done in the way of research, but also advocacy, and that's advocacy from the individual, from the patient, and also all of the clinicians that are looking after women who are at increased risk of cardiovascular disease, whether it's because of family history, traditional risk factors, or other risk factors like having another condition that puts them at increased cardiovascular risk.
Thank you so much, Dr. Harvey, for the valuable information you shared with us today. For more details and additional resources we have available, please visit WearRedCanada.ca. To conclude, we want you to be mindful, curious, and proactive in the management of your heart health and wellness, because to take care of others, you need to first take care of yourself. Stay safe and heart healthy.